Borderline personality disorder is a mental health disorder that impacts the way you think and feel about yourself and others, causing problems functioning in everyday life. It includes a pattern of unstable, intense relationships, disordered self-image, extreme emotions, and impulsiveness. Symptoms of borderline personality disorder include extreme reactions that may involve panic, depression, rage, or frantic actions, specifically pertaining to abandonment. These symptoms can create a roller coaster effect in relationships with family, friends, and loved ones. This can include fluctuation between idealization, which is extreme closeness and love, and devaluation, which is extreme dislike or anger. Other symptoms can include an unstable or disordered self-image, which can lead to sudden changes in feelings, opinions, values, or plans for the future. Other characteristics attributed to this disorder can include impulsive actions or behaviors such as unsafe sex, substance abuse, reckless driving, and binge eating. Self-harm and suicidal behaviors may also be associated with borderline personality disorder. Fluctuating moods and chronic feelings of emptiness or boredom may be attributed to this disorder, along with intense anger or anger management problems. Paranoid thoughts and dissociative symptoms and behaviors such as losing touch with reality, observing oneself from outside the body, and feeling cut off from oneself and or reality may be symptoms felt when dealing with this disorder. Borderline personality disorder is very common, and early signs can be shown at young ages. Many things may cause or contribute to experiencing symptoms that are associated with BPD. Although studies are being conducted to further inform people about borderline personality disorder, the public should be properly informed on the effects that this disorder might have on families, communities, and society as a whole. Borderline personality disorder is a disorder that affects the mood of the individual, therefore making it hard for family members to keep up with mood changes. Patience is key when dealing with someone diagnosed, and full support of the individual is necessary in order for them to heal properly. Many types of psychotherapy can be used to help the treatment process depending on the patient and their response to it. Treatments such as cognitive behavioral therapy can help reduce extreme fluctuation of mood and anxiety symptoms along with any suicidal or self-harming behavior. CBT is meant to change the beliefs and behaviors of the patient that may be causing the disorder. Dialectal behavior therapy is meant to help bring a patient in touch with their emotions in order to control them, along with reducing self-destructive behavior and mending or improving relationships. DBT focuses on not only changing the beliefs and behaviors, but accepting them as well. Schema-focused therapy is meant to help a patient reframe the way they view themselves. This form of treatment focuses on interaction with the environment and with others while coping with one's problems and stress. Although medical treatments specific to borderline personality disorder have not been FDA approved, many medications such as antidepressants or mood stabilizers are already approved that can help treat specific symptoms attributed to borderline personality disorder. If your loved one has borderline personality disorder, it's important to recognize that they are suffering. The destructive and hurtful behaviors are a reaction to deep emotional pain. In other words, they're not about you. When your loved one does or says something hurtful towards you, understand that the behavior is motivated by the desire to stop the pain that they are experiencing. Learning about borderline personality disorder won't automatically solve your relationship problems, but it will help you to understand what you're dealing with and handle difficulties in more constructive ways. Now that you have had the inside look into borderline personality disorder, you are knowledgeable on what it is, the symptoms, its impact, appropriate treatments, and the support necessary for those suffering with this disorder. I hope that with this knowledge you can now be more comfortable with those diagnosed and more readily supportive and understanding of those affected. Thank you.